Dear friends, welcome to episode number 12 from the Psyche and Human Body podcast. I'm your host, Reda, and today's guest is Dr. Renata Costa. Dr. Renata is a Brazilian certified board dermatologist. She's a specialist in aesthetic dermatology. Today, she will be educating us on the best ways and method to take care of the skin and the hair, in addition to how to fight off aging. I'm pretty sure that this is a topic that interests many of the people out there. I hope you enjoy this episode. Please leave all your comments in the section below, either you're listening on YouTube or Spotify or on Instagram. I'm here to help. I'm here to help you educate and answer all your questions. I hope you enjoy. I'll see you later. Thank you very much. Let's get into it. Dr. Renata, welcome.
Yes.
Welcome to the show.
Thank
you so
you.
much for accepting the invite.
My
I
pleasure.
really do appreciate you coming in over here today. Can you please introduce yourself to the audience? Who is Dr. Renata?
Okay. So I'm a Brazilian board-certified dermatologist with more than 20 years of experience in the field. I had my private clinic in Brazil for 15 years, and then on August 2018, I came straight from Brazil to Abu Dhabi.
Mhm.
So I'm here 5 years and a half.
Mhm. Doctor, why did you come to Abu Dhabi? Like, if you had your clinic back in Brazil, like, why did you choose Abu Dhabi in particular?
There was an opportunity of better work,
Mhm.
and the quality of life here, it's amazing. It's
I see.
amazing. I'm really in love. And my life and my husband's life, our lives now, it's here in Abu Dhabi. Brazil, for us, we go to see our parents. Alhamdulillah, the fourth of them are still alive.
Thank God.
But our life, it's here. The place, it's amazing. We love it.
Beautiful. Doctor, you are a dermatologist, so I think let's jump into the topic and
Sure.
start with the basics with the audience. Let's start with the basics. What are the most of the big misconceptions about skincare? Like, what are the things that we are doing as people, as normal individuals, that is wrong and affecting our skin in a bad way, let's say?
So one of the most common mistakes is not using the sunblock or using not properly. Most of the people, if they use only once a day, usually in the morning.
Sure.
So also use the wrong skin cares according to the skin type.
Okay.
For example, if you have an oily skin and you are using a cream for dry skin. So this is another common mistake.
True.
And then also here it's more common than in Brazil, especially this time of the year because it's winter. Use hot water to take a shower, to wash your face. Hot water is not nice for the skin.
It's not good for the skin.
No.
Why is that? Why is it not good?
It makes for the face and even for the scalp, it can make the oily worse. And on the body, it makes the skin drier. So in the whole body, you can have itch.
I see.
That's why.
So is it suggestible, let's say, to shower and wash our faces with cold water?
Cold water, if you don't like, at least warm but
water.
not hot. It's not good.
Beautiful. So speaking of the skincare and the sunblock and the creams, like how can we identify for example, the right product for the right skin? As normal individuals, let's say if we went to the market, what should we look for example?
Most of the skins, we say they are mist. You know, the center part, it's oily, and on the lateral, usually it's a little bit normal or dry. So it's better to go for products for oily skin because the texture is going to be more pleasant to use, especially here because most of the year the weather is hot.
I see.
You know, but I would say the best way is to go to your trusted dermatologist because then we can examine, we can access the skin and choose the best products.
Very true. Now, doctor, you see also that now with the modern day social media, like a lot of the people, they tend to go and seek information from the internet, which I think is reflects in a bad way for the community. So how do you think, for example, we should educate people on the source of information which they should follow? Because on the internet, there's many bad information. What do you think is the role of social media in today's world?
The social media helps, and at the same time, it can be an enemy. So it helps because for us as a doctors, we are closer than people that we are closer to our clients. So if it's a good information, a source that you trust, let's talk about doctors' Instagram, for example.
True.
Usually the informations you can trust. And it can be an enemy because sometimes it's all about trending.
Very true.
It's not
Very true.
about science. It's not about if the product it really works or not.
Yeah.
Especially in my case because I do evidence-based medicine. So if the industry doesn't prove to me that the product works, I will not use. It's not about trending. It's not about who is advertising, if it's famous, if it's not famous. So we as a doctor, we should educate our clients. Usually, I used to say to my clients, you have any doubts, please talk to me, because the best place to clarify your doubts is inside doctor's office. Talking generally speaking, not only about dermatology, because in all the medicine fields, there is these trendings. And sometimes they are not true. Sometimes they are true, they are good, they really work. And it's hard for the common people to separate.
Identify. Yeah.
Exactly. So then it comes us as doctors to educate even the population.
I see. Beautiful. So let's go back to the skin. So for the basic person, in order for them to take care of their skin, like the number one thing is using the sunblock and using the right cream for the right skin type. And in addition, we need to use, let's say, warm to cold water if possible. Why cold water? What does it do for the skin, basically?
The cold water helps for the face to shrink the pores. So, and for the body, we don't lose, because normally we lose a little bit of water from the skin. This is physiological.
Okay.
So if the water is cold, the body can keep this loss of water in a normal level. The hot water, it dilates the pore. So we lose more normal water from the skin, let's say like that. So that's why the skin can become drier, and that's why it can come itch, it can come irritation, even eczema. That's why.
I see. So this is when it comes to skin, like most common misconceptions and how to take care of it. Let's talk a little bit about the hair before we jump in more into a bit more details. So the hair, the misconceptions as well, like how can we take care of our hair?
First, like the skin, cold water, it's better to wash the scalp. Use shampoo, not soap, to wash the hair.
Shampoo, not soap.
Yes. Right. Soap is good for the skin. But for hair, even for beard, shampoo is better. And it's going to clean even the scalp and also the hair as well. Not soap.
I see.
Also, if you wash your hair and you want to wear a hair cap or a gutra or a shella, or it's time to go to sleep, the hair should be dry, not wet. So maybe wash your hair late at night. Just dry, not blow dry. Just dry before you go to bed, or before you wear a hair cap or gutra or shella. Because if the hair is wet and you close, you put anything to block the scalp, it will cause oily and even dandruff.
I see.
That's why.
In this scenario, like, what are the things? Is there any certain, let's say, ingredients in the shampoo which we should, let's say, focus more on? Because I read on the internet, I don't know if I'm correct, but some of the ingredients make the hair worse or make us lose hair. So is that true? Is there like certain ingredients which we should look more often, let's say?
This is a myth.
All right.
This is a myth.
Let's talk about it.
Some time ago, they blame the salt on the shampoo for all the damage for the hair. And actually, there is no shampoo without salt. Talking about chemical products, because the salt is the one that cleans. So this is a misconception. This is a myth. I used to say that good shampoo, it's the one that works nice for your hair. It's very individualized. So maybe a shampoo that works for my hair doesn't work for yours, and vice versa.
How can we know?
You have to try. And it's not about brand, it's not about price. The X brand costs very high, so it's going to be better than the Y brand that costs very low. No, it depends on the hair. It's not about, so it's the hair and the shampoo. So you have to try to see. And I used to say, some hair, they are very cheap. A cheap shampoo works very nicely. And some hairs, they are more demanding. They need a more expensive. But this is very individualized. It's not about the price. It's not about the brand.
Beautiful. So let's say we shouldn't focus on, let's say, the type of brand, the type of product itself. We should experiment and see, let's say, what's the best that's going to work for us. Because maybe what works for me might not work for you, and vice versa.
Exactly.
Beautiful. So let's move forward a little bit, doctor, into the world of Botox. Like nowadays, it's very trending. A lot of people are using Botox as a filler. What can we know about the Botox, the uses, let's say the misconceptions, and how can we use it properly?
Okay. So Botox is a neurotoxin. It is produced by a bacteria called Clostridium botulinum. And actually, we should say botulinum toxin, because Botox actually it's a brand. It was the first brand created. But actually, all of us, even as doctors, we say Botox even for other brands. It's easier. So this toxin, it relaxes the muscle. This is the mainly action of the medicine. So on the face, we treat dynamic lines, the lines that appears when we move. So when you do a surprise face, if you have lines, it's for Botox. If you are angry, here. If you smile and you have cross feet, here. Botox also can treat gummy smile. Some people, when they smile, they show a lot of the gum. So when we apply here, it will hide a little bit. The smile is going to be the same, but without showing the gum.
How is it going to hide it? Like, would the lip be over it?
No, because when we smile, there are some muscles pulling up here and here. So we are talking about muscle. So once we apply here, we are just going to relax the muscle.
I see.
You know, so that's how it works. Botox can be applied on the chin. Some people, when they talk, the chin, the muscle of the chin moves and it becomes like a cellulitis. So we apply. Some people, they have this muscle, the masseter, very strong. So especially for women, it can make the face a little bit wider. So when we apply, the face looks a little bit thinner. Botox can be done on the neck and also to treat excess of sweat on underarms, on the palms, and also on the soles.
So we can use Botox as, let's say, a blockage for sweat.
Yes.
Is that, let's say, a good thing to block the sweat from going out in the body?
We are talking about excess of sweat. Excess, not 100%. No, because it's also a physiological response of the body. So some people, they sweat a lot. Talking about the hands, some clients, when they do like this, the sweat starts coming out. Even for teenagers, sometimes they get nervous during a test. They cannot write because of the sweat. So Botox will help like that to reduce the excess of sweating, not to stop sweating. No.
Beautiful. Doctor, I need to go back to a point where you mentioned before eczema. I also like hear about it from people because one of my friends actually had an eczema for a long period of time in his life. What are the causes of eczema and how can we treat it?
Eczema, there are lots of causes and lots of types as well. The most common is the dry skin. So as we spoke before, you take care of your skin by taking cold shower or at least warm water, it's fine. Good moisturizer. When I say good moisturizer, also it's not about brand, it's about the quality. Usually the moisturizers that you buy on the pharmacies, the quality are better than in the supermarket. But maybe for any reason client cannot buy in the pharmacy, use the one from the supermarket. It's better than not to use anything. The good moisturizer should not have smell. This is my mainly concern because the perfume can irritate the skin. So if you want a good smell, a perfume, use a perfume, but not the smell in the moisturizer. especially for clients that has eczema. So because the smell, the perfume, the basic of any perfume, it's alcohol. And the alcohol can remove the normal water of the skin and can make the eczema worse. That's why. So talking about eczema, dandruff, it's a type of eczema. And we have dandruff on the scalp, but also on the face, on the beard, on the nostrils. So the doctor will examine and see which treatment is better. Because before talking about treatment, we need to see what type of eczema. You know?
So let's say what stems this eczema. Let's say what's the root cause. Then upon it, you can, let's say, choose the best path of treatment for it. Beautiful. Doctor, I myself, when I was a child, I faced a lot of time where I had acne. And it affected me heavily when I was a child. I tried many treatments and none of them have worked. What can you tell me about acne, the also causes of it, and how can we treat it in nowadays technology or modern day technology, let's say?
Acne is a very common problem, especially between teenagers. Usually it starts when the person enters the adolescence. Mainly the influence of the hormones on the skin changed. That's why usually it starts during a teenager age, let's say like that. But actually it can be caused by hormone imbalance, some medicines, especially B12, and here people like to take B12. If there is a deficiency, perfect. But if there is not, in the B complex, the issue for the skin is the B12. It can cause acne in a person that even the person doesn't have acne. Stress can cause acne. The wrong use of skincare, or even for women, the wrong use of the makeup according to the skin. So because usually acne, who has acne, the skin is oily. If you use anything on the skin that it's very creamy, that it's very thick, it's going to make the acne worse, or it can cause the acne. And for anybody that has acne, start the treatment as soon as possible. Because to avoid the consequences of acne that are scars and pigmentation. So the sooner we start the treatment, the better the skin will be.
Back then, like they prescribed for me something called Roaccutane. I don't know if it's familiar. It was the only thing that solved my problem. By then, I got to be very dry in order for the acne to disappear. So do you think that this is a good way to for others to use, or should they, let's say, consult with the dermatologist first? Because a lot of the people nowadays are just going for the Roaccutane because it showed many benefits before. So what's your idea about Roaccutane, doctor?
Roaccutane is amazing. When we talk about cure of acne, it's only possible with Roaccutane. The Roaccutane is a brand. The name is isotretinoin. But it depends on the type of acne. So the acne goes from the type 1 until the type 5. We think about Roaccutane starting from the type 3. The client has big pimples, you know, and even the emotional, it's affected. So Roaccutane is amazing. But for a person that has mild acne, there are another type of treatment. There is topic antibiotic or even oral antibiotic. There are creams to stop and to improve the skin, but not to be so aggressive as Roaccutane. So the best is to consult the trusted dermatologist, and the dermatologist will choose which is the best for each case. And sometimes Roaccutane comes back to the media as a trending. And it's not like that because it's a controlled medicine. You need a prescription. Without prescription, you don't buy. Before taking, we have to check the liver function, the kidney function, to see if everything is fine. Then we start the treatment. It's amazing. I use it, but for the correct indication.
Beautiful. Because also back then they used to like take my blood test every now and then to see the lipid levels if they are balanced.
Exactly. And for the ladies, we even need to check if she's not pregnant. This I'm talking about legally. It's not, we need to confirm that she's not pregnant to prescribe, because this medicine, if the woman is pregnant, 100% the baby will have problem. So me as a doctor, legally speaking, when I prescribe, there is a consent term that I put the result of the test saying that it's negative, and then I can prescribe.
I see. Beautiful. Doctor, you mentioned stress.
Yeah.
Now, stress is something that I read that it can cause many problems, from hair loss, skin damage, and many things. Can you please tell us what can stress do to our bodies?
Oh,
Let me know where to start. 1, 2, 3, 4.
yeah, I'm going up, down. So you correctly speak about hair loss. It's one of them. It's very common. Acne, eczema. Some diseases are stress related, like psoriasis, urticaria, vitiligo. All of them are stress related. So I used to say, our mental health, if you are fine, if we are fine, the skin, the hair, everything will be fine, like the body as well, you know. But our mind, it's the boss.
Yeah.
We should be as fine as possible, and then the skin will be fine. But lots of problems on the skin can be caused by stress.
Doctor, why is that? Like, why, if we are stressed, what changes happen in our bodies that affect our hair follicles, our skin, and such? Like, what happens to our body when we are stressed?
The stress release in hormone, the cortisol. We say the stress hormone.
Yes.
On the scalp, even on the skin, it causes a vasoconstriction. So the blood flow reduces. So the hair follicle gets weak, and then the hair starts falling. On the skin, because of the vasoconstriction, that we reduce the blood flow, and the blood is one of the source to moisturize the skin inside. I'm talking about inside the skin. So that's why it can become dry. But at the same way, depending on the body, it can cause on the skin, the same hormone can cause a vasodilation. And then if you have oily skin, your skin can become oilier. So the human body, it's still a mystery for us, because the same cortisol can work in both ways, make the skin dry, but cause also oiliness.
I see.
So it works like that.
Is this the same reason why, for example, if we lack sleep, it will also reflect on our skin and hair? Is it because our cortisol levels increase if we don't have good sleep?
As well, also. And when we have lack of sleeping, there is another imbalance between an hormone called melatonin, and it also works on the skin. The way melatonin works on the skin and also on the hair, it's still a mystery. There are some theories, but none of them is still proved if it's work really like that. But also a good night of sleep, it's
also perfect
very important.
Exactly, yeah, because like I was also reading like how it also affects like everything that we do in life somehow reflects in our bodies.
Exactly.
Like stress levels, like food, everything that we do also reflects in our skin and hair. It's beautiful.
Speaking about food, I remember something about acne. It's another cause of acne. If you don't have a healthy diet. If you go only for junk foods, also if the food is very oily, also it can cause acne.
So the junk food, are we talking only, let's say, processed food? We should stay away from processed food? Or is there any certain types, even of, let's say, the normal food, the natural food also that affects the acne?
This is very individualized as well. So there is the junk food, but also mango, the fruit, can cause acne. Nuts, milk and cow's milk and dairy products. But this depends on the person. One client, mango is the issue. The other one, nuts. The other one, chocolate. So me as a doctor, I need to ask, do you eat this? Then I can find what is the issue. So it varies, you know?
Doctor, speaking of stress, is there any product that we can use to, let's say, mimic or cover the effects of stress? Is there any modern day, let's say, cream or medication that we can use to cover the effects of stress from hair loss and skin damage? Or should we, let's say, care for stress because there's no other way to combat it, let's say?
We should go together. combat the stress, but also do the treatment. For example, hair loss, there is, according to the type of the hair loss, because there are different types, we have the treatment. And I used to say it's homework and classwork. So there is the treatments that I can do in the clinic, and there are the treatments that client will do at home. So for the skin, according to the issue, if the skin is dry, we have the treatment. If the skin is oily, we also have the treatment. So even with the stress, of course, we can treat. And sometimes, depending on the cause of the stress, it's difficult. I wish we have like a magic,
right? Like a magic pill just for stress.
Halas.
And that's it. No more stress.
Exactly.
I think like most of our problems in life will be solved. Like, if not,
Exactly.
that's it. Pill and
I
we're
wish,
good to
my
go.
dream.
Let's work on that then, I think. Doctor, I think that there's something that a lot of people have on their mind, which is aging. Like, people think that we cannot combat aging because as we age, our skin gets worse, we start losing hair and such and such. How can we care for ourselves as we age? Is there any certain things which we should consider more compared to a young person? Let's say?
First of all, age is part of life.
Yes.
And when we age, we are blessed. It's not easy to say it's easy, but to put this on the mind, it's not. But we can age nicely. I used to say we don't grow old, we get better. You know?
Yeah.
So, for example, there are procedures, the aesthetic procedures are here to help for us to age better, but not to, if you have 50, you are going to have your 20s face. No. This is something also that the social media, sometimes they put like a miracle, and it's not like that. And there is a beautiful to get old. Why not? You know, each age, we have a different kind of beauty, you know? So the aesthetic procedures are here to help. And then talking about the hair, we can also improve the quality of the hair as well. But first of all, I used to say, be happy. You know, because our state of mind, if we are happy, we are fine, everything will flow.
Yeah.
That's it.
Very true. So it reflects like our state of mind. It reflects on what happens in our life, like our skin and everything that comes with it.
Yeah.
Beautiful.
The skin is the biggest human organ. So that's why. And talking about stress, each person has a stress organ. So some people it's the stomach, some people it's the hair that start falling, some people it's the skin. So, and the skin is the biggest one. So usually it's the more affected.
Because the biggest, so it's like has the biggest portion, let's say, in a sense. So, like in your opinion, we should, let's say, not think too much about reverse aging. We should, let's say, embrace it, like enjoy it in a sense, like enjoy each part of our life and with the beauty that comes with it in a sense.
Yeah, and like a skincare, aging or not aging. First, the use of sunblock, because the sun with time can the skin can be more aged. So if you take care using a good sunblock and in the proper way, that is every 4 hours or at least twice a day, the quality of the skin will be better. Eat a good diet, have a good diet, do exercise, don't smoke, avoid alcohol.
Yes.
You know, all of these will reflect in the general health and also on the skin as well.
Nice, very nice. Doctor, what's the role of collagen in skincare and hair, nails and everything? Because I always also read about it, that collagen is very important for these things. So what role does collagen play in our overall health?
Collagen is our best buddy.
Our best
friend. And from the 25 years of age, we start the production of collagen start decreasing 1 to 2% per year. So at least in our 30s, we should start helping the body to produce a little bit more and better collagen. So there are injections for these, the collagen biostimulators. There are machines that helps. Of course, the aging will keep happening, but it can be better. But the collagen is the most important. I am the dermatologist that loves collagen supplements.
Yes.
They, in my opinion, they work. And between powder and tablets, the powder are better used by the body. But sometimes they don't like the powder, go for the tablets. But it helps. It really, in my opinion, it really helps. I like it.
Is there any like certain form of collagen that we should look for into the market? Because I don't know if I'm correct. I read once that we should have some look for hydrolyzed collagen. Maybe that's the best form to buy. So is it the best form that we should always buy, or is there any other thing that we should consider?
Yes, this is true. The hydrolyzed collagen, the brand, the most common one, the name is Verisol. It's a German brand, but it's the hydrolyzed collagen. The body can absorb better. So if you find this, perfect. If you don't find, you can go for the other. It will help. It's not useless. The other ones.
Can we find collagen in food? Is it available in certain foods?
It is, but it's not easy because usually it's on the joints from the animals, like cow, like pigs. So it's not, at least for me, tasty. You know, because usually the collagen, the mainly source of collagen are the joints. Ours and also the animals. But talking about plants or fruits or vegetables, no. We go for vitamins, we go for minerals, but not collagen.
So the collagen is available, let's say, in the joints and bones of animals.
Yeah.
So as usually do people, they boil the bone and like drink, let's say, the soup.
Yeah.
In a sense. So this is it?
It is, but when you boil, you lose the quality. So it's not the same when you do when you take the supplement.
I see your point, doctor. I see your point. Doctor, I also once read that sometimes stress can cause certain diseases on the skin. Is that true? Is it related or not? I don't know if that's something true.
It's related. I cannot say it's the cause, but it's related and it's scientifically proved. Some diseases like vitiligo, psoriasis, alopecia areata, they are related to stress. When they happen, for example, especially vitiligo on children, it's very common something happen in the child's life. Or the parents get divorced, or something's happening in the school, or the child, somebody very close to her or him died. Usually there is something. So it's related. But as a doctor, I cannot say it's the cause. Because for us, doctor, when we say it's the cause, if you remove the cause, it's cured. So if we say it's caused by stress, if you remove the stress, halas.
Yeah,
and it's not like that. But it's related, this is true.
Very nice. Beautiful. Doctor, what are, let's say, things which you want to share from your point, from your experience over here in this community? What are most of the things that you notice we do wrong, and how can we improve on it? What can you tell us about that, please?
So, first of all, love yourself first. Have a trusted dermatologist. And in your trusted dermatologist clinic, you are going to clarify all your doubts. Be careful with social media trendings, because they are good, but sometimes they can harm you. And use a good sunblock.
Yes.
All the time I say this to my clients. And if you're talking about aesthetic procedures, there is no age. If you want to do, go to your trust dermatologist and she or he will tell you, do this, do that. If you don't want to do, don't do. It's not because your friend did, your mom did, your aunt did, you have to do. No. First of all, love yourself. If you're happy with the way you look, why you want to do something, And if you want to do, go for the natural look. And all of us, each one of us, we have a beauty. And we have something specific. So don't try to change yourself for you to look like the other lady, someone else. No, don't do this. Don't follow this trending. This is not nice.
Very beautiful. Like be individualistic, let's say, enjoy the beauty of being individual.
Exactly.
Yes.
It's even the beauty to not be perfect. One side of the body, it's not like the other. And this is what makes us unique.
Yes.
Don't look for perfection. Look for improvement, the good things that you have. And we can hide the not so good.
Yes.
But not perfection. No.
Very beautiful. Doctor, thank you so much. Thank
My
you so much
pleasure.
for coming in today. I really do appreciate the information that you showed us today and what you presented with us.
Thank you.
I wish you all the best for you and your family and nothing but happiness in life.
Thank you so much.
Thank you so much for coming in today and
My
all
pleasure.
the best.
My
Thank you.
pleasure.